as we are continuing parasitology, and today our topic is mainly intestinal flagellates. This is a kind of topic you have to know for Giardia. Giardia is a parasitic organism. It's very clinically important also because you get lots of diarrhea and abdominal discomforts. So you have to know what is Giardia. These are only parasitic infections is important in intestinal flagellates. So it is a very small topic, intestinal flagellates. How we, what is intestinal flagellates? Regarding little bit of morphology and how we diagnose. And clinical symptoms is more or less same for every parasitic infections like abdominal discomforts and others related features. So it's a protozoa parasite with flagella for motility. This is very much active motile, and we diagnose microscopically to see the trophozoite form by its motility. We'll see that motility at last, and basically they infect human gastrointestinal tract and can cause asymptomatic infections, diarrhea and malabsorption syndromes. Kingdom Protista phylum, so forget about it, this is not that important. Now, what are the key examples? First is the Giardia. Giardia Lamblia is a main important part. You just know only one name, that's enough. Forget about rest. কারণ প্রত্যেকটা টপিকে আমি বলে দেবো কতটা ইম্পর্টেন্ট কি লাগবে, রাইট? You have to know malaria very well. You have to know tuberculosis very well. You have to know cholera very well. You have to know E. coli very well. But in Giardia, you have to know very much little things. Well, you have to do a smart study because syllabus is vast, right? So this is about the morphology of Giardia Lamblia. You might be familiar of this picture. কোথায় গেল রে? এই রাজা কাজ করে না তো, হ্যাঁ? অত দূর থেকে নেবে না? ও আচ্ছা, এই যে পড়ছে, এমন পড়ছে সেটা কাজ করছে, বাট ওই আর কি, তোকে তোর গায়ে লাগছে, এখানে লাগছে। সো দিস ইজ ট্রোফোজয়েটস, এবার একটু বেড়েছে, হ্যাঁ বেড়েছে। ইউ মাইট বি, আরে ইয়ার, ইউ মাইট বি ফ্যামিলিয়ার, আরে কি you might be familiar of this picture, okay? Is a pear-shaped bilateral symmetrical 2 eye-like nuclei, 4 pairs of flagella and ventral sucking disc. So this is all about is morphology, and this is a cyst form. This is trophozoite form and this is a cyst form. Oval shape, 4 nuclei and median body visibles. The median body. This is all about morphology. বাকি আমাদের আর বেশি কিছু লাগবে না। আবার বলছি, this is just heard the name once: Chylomastrix, Trichomonas and Dientamoeba. ठीक है? Just know about Giardia. That's it. বাকি না বললে, না মনে রাখলে কিচ্ছু অসুবিধা হবে। কি বললাম বুঝতে পারছো? Now, clinical features of Giardia Lamblia. Its incubation period is 1 to 3 weeks. Symptoms: greasy, foul-smelling diarrhea, abdominal cramp, having the same features. May mimic IBS, especially in common in children. Now, laboratory diagnosis of intestinal flagellates. So, this is the important part as per microbiology. How we diagnose this. So, involves clinical suspicions, specimen collections and appropriate lab techniques. This is 3 important part for any diagnostics of any infections, any parasites. And our aim to accurate identification by trophozoite and cysts. What is the morphology we have seen? that has to be identified in stool samples. That's a dictum. Okay. Now specimen collections, fresh stool samples. First is a fresh stool samples. So multiple samples needed for different days for improved accuracy. Why we are AB samples for 3 such? Why? Because it's very difficult, right? Because they are the minimum amount. So you have to, that's why send the samples for repeated 3 days. Okay, fine. Then we can confirm it, this is a negative. So multiple samples on different days for improved accuracy. Reasons, parasite shedding is intermittent. That's also reasons. Detects trophozoites and cysts. Trophozoite is a motile form. When we can see in a saline mount, we can see the trophozoite is motile and lead little bit of preservatives, 10% formalin for concentration and PVA for staining. Another technique we can use, one is a stool sample, another is a duodenal aspirates or sting test, used when stool tests are negative but suspicion is high. আমরা যখন stool sample we get a negative result, then we offer what? Sting test or duodenal sampling test, especially useful for detecting Giardia Lamblia. Now microscopy. What we get first is a direct wet mount. Direct wet mount is a saline mount, shows motility of trophozoites. We'll see this video at end in YouTube, motility of trophozoites, and we can do iodine mount, highlight cyst in internal structures, ideal for quick staining in fresh and warm stool. Then we can do concentration techniques. Concentration technique is formalin, ethyl acetate sedimentations. Why we do actually concentration techniques in parasitology? Because the load of parasites is not that so much in stools, right? So if we apply a concentration technique, in this technique we will what? Concentrate the parasitic load in the stool samples. So it's getting very easier to identify. Your concentration technique itself comes as a short note. Concentration technique in parasitology. This all the concentration techniques itself comes as a short note. Prepare for it. Okay. So here we apply to formalin ethyl acetate sedimentations. We have to centrifuge, examine the sediments. Advantage is remove the debris and concentrate parasites. And another concentration technique is the zinc sulfate flotation technique. Less effective. First is an better. So just remember the two names, formalin ethyl acetate sedimentations and zinc sulfate flotations. Iodine stain highlights nuclei glycogen vacuoles used for quick cyst identifications, and limitations is the poor trophozoite preservations. So one is a normal microscopically stain. This is a direct wet mount and another is a iodine mount. Then is a trichrome stain. This is a gold standard for morphology. It highlights the color of the nuclei red and purple and cytoplasms are blue green. Advantage as a permanent and detailed. And last there is a iron hematoxylin stain. Visualize the detailed internal structures less commonly used today. So these are the three stains you have to remember. One is a normal saline mount, another is a iodine mount, and another is a trichrome stain, and last is iron hematoxylin stains is a less used. Okay. And then comes that all the antigen detections and PCR. This is common for everywhere. ELISA detects Giardia Lamblia antigen, highly sensitive and specific. Immunofluorescence, fluorescence antibody detections, highly accurate for Giardia and Cryptosporidium. Here for Giardia. Molecular diagnostics, we know PCR can diagnose each and everything. So, detects DNA parasites like Dianthema fragilis and also Giardia. Strain specific and genotypic ID you will get and very sensitive, but there is a limitations of the every PCR is a costly and it is a lab intensive. Now we are talking about gastro samples, that is a sting test. Why we are doing sting test? Because there are the, if we have a clinical suspicions when patient is suffering from Giardia and you can't get in a stool samples, trophozoite or cyst, then you will do what? The stings test, right? So gelatin capsules swallowed, stings reach to the duodenum and after 4 to 6 hours withdraws the stings, examine microscopically, detects Giardia trophozoite from upper small intestine. So this is about sting test or also we can call dentado test. And lastly, this is a summary of all the tests. First is the wet mount. What will they see the structures? Both trophozoite and cyst. This is the first line and rapid test. Need fresh stool. Then we'll can do concentration technique. Concentration technique will do wet mount, but this is we can see that trophozoites and cyst is normal wet mount, but when we are applying concentration technique, we can see only cyst. The trophozoites are getting destroyed. What my point? The same technique we are seeing the after applying concentration technique, we will see the what? Either wet mount, either iodine mount, but the trophozoites getting destroyed. In the staining, that trophozoites and cysts both we can see detailed morphology, and trichrome stain is the best stain. And then comes ELISA and IFA. Antigen we will detect. PCR or parasitic DNA, highly cost is the disadvantage. And lastly, the sting test. We can see the trophozoites when stool test has failed, but suspicions remain high, especially for Giardia. This is a basic summary table, and see this is enough for the laboratory diagnosis. For Giardia, we have to draw a picture of the morphology and is just clinical symptoms, abdominal discomforts, और এই টেবিলটা বুঝলি ठीक है I think this is enough. Now the treatment part. Just know about Giardia Lamblia. Metronidazole is a drug of choice, and there is alternative tinidazole, metajoxanide, albendazole, but metronidazole is a drug of choice. So we all know that ofloxacin-onidazole, that onidazole can also kill Giardia. Okay, we give combinations drugs, right, to the any diarrhea. Lastly, the preventions, practice personal hygiene, because all the parasitic infections are because of the poor sanitations, poor hygienes are responsible for that. So practice personal hygienes, boil filters drinking waters, improve sanitations, avoid raw and undercooked food when traveling. So this is how you can prevention and control. For so this is done all about Giardia. We reached small topic, intestinal flagellates. You have to know the morphology. Morphology, you have to draw the diagram. The Giardia diagram is very important. If you are having a short note, is a high probable that intestinal flagellates or Giardia come as a short note. So just draw the diagram, the morphology of trophozoites and cyst, then little bit of clinical features, abdominal discomfort, flatulence, and all those others abdominal symptoms, and after that lab diagnosis. Lab diagnosis, we have just, you remember that table, not so much, just remember the gist of the summary table, that's enough, right? For treatment part, metronidazole is a drug of choice for giardia, and you don't have to know too much. Okay.